Myself, Navjot Kaur, working as a vocational trainer at school GSS Akkanwali. Today we will discuss the topic of class 12 2-year pattern unit 2 LOs for surgical asepsis, LO number 5 learning outcome, 5th disinfection of operation theatre, and 6th last is surgical dressing. First of all, surgical asepsis. Asepsis. Definition of asepsis. Asepsis is the state of being free from disease causing contaminants such as bacteria, virus, fungi and parasite, preventing contact with the microorganism. asepsis ਇੱਕ ਇਸ ਤਰ੍ਹਾਂ ਦੀ ਸਟੇਟ ਹੈ ਜਿਸ ਦੇ ਵਿੱਚ ਆਪਾਂ ਕਿਸੇ ਵੀ ਚੀਜ਼ ਨੂੰ ਮਾਈਕਰੋ ਆਰਗੇਨਿਜ਼ਮਸ ਤੋਂ ਫ੍ਰੀ ਕਰਦੇ ਹਾਂ, ਮੀਨਸ ਕਲੀਨ ਕਰਦੇ ਹਾਂ, ਉਸਦੇ ਉੱਪਰ ਕੋਈ ਵੀ ਮਾਈਕਰੋ ਆਰਗੇਨਿਜ਼ਮ, ਬੈਕਟੀਰੀਆ, ਫੰਗੀ, ਪੈਰਾਸਾਈਟ, ਵਾਇਰਸ ਕੁਛ ਵੀ ਨਾ ਹੋਵੇ, ਉਸ ਨੂੰ ਆਪਾਂ asepsis ਕਹਿੰਦੇ ਹਾਂ. The term asepsis often refer to those practices used to promote or induce asepsis in an operative field in the surgery or medicine to prevent infection. Means asepsis की यूज़ एक इस तरह की प्रैक्टिस है जिस दे विच आपां डिफरेंट प्रैक्टिसिस करते हैं उस सर्जरी या मैडिकेशन के दौरान उन्होंने इन्फैक्शन तो फ्री करने लई. Next is asepsis are of two types, medical asepsis and surgical asepsis. Medical asepsis is any practice that helps to reduce the number and spread of microorganisms. ਮੈਡੀਕਲ ਅਸੈਪਸਿਸ ਦੇ ਵਿੱਚ ਕੀ ਹੁੰਦਾ, ਆਪਾਂ ਉਸ ਮਤਲਬ ਕਿ ਮਾਈਕਰੋ ਆਰਗੇਨਿਜ਼ਮਸ ਦੇ ਸਪਰੈਡ ਨੂੰ ਕੰਟਰੋਲ ਕਰਦੇ ਹਾਂ ਅਤੇ ਉਹਨਾਂ ਦੇ ਨੰਬਰ ਨੂੰ ਕੰਟਰੋਲ ਕਰਦੇ ਹਾਂ, ਉਹਨਾਂ ਦੀ ਗਿਣਤੀ ਨਾ ਵਧੇ. ਠੀਕ ਹੈ. ਸਰਜੀਕਲ ਅਸੈਪਸਿਸ ਦੇ ਵਿੱਚ the complete removal of microorganisms and spores from the surface of an object. ਮਤਲਬ ਕਿ ਸਰਜੀਕਲ ਅਸੈਪਸਿਸ ਦੇ ਵਿੱਚ ਆਪਾਂ ਕਿਸੇ ਵੀ ਆਬਜੈਕਟ ਦੇ ਸਰਫੇਸ ਤੋਂ ਕੰਪਲੀਟਲੀ ਰਿਮੂਵ ਕਰ ਦਿੰਦੇ ਹਾਂ ਮਾਈਕਰੋ ਆਰਗੇਨਿਜ਼ਮਸ ਨੂੰ ਅਤੇ ਉਹਨਾਂ ਦੇ ਸਪੋਰਸ ਨੂੰ ਵੀ. Surgical asepsis. It refers to the procedures used to keep the object or area sterile or completely free from microorganisms. And in surgical asepsis, all practices are directed to the elimination of both pathogenic and non-pathogenic microorganisms. Now, difference between medical asepsis and surgical asepsis. Medical asepsis reduces the number of pathogens. In surgical asepsis, eliminates all pathogens. In medical asepsis referred to as clean techniques, whereas surgical asepsis is known as sterile technique, used in administration of medications, anemias, tube feedings, daily hygiene. Surgical asepsis is used in dressing changes, catheterization and surgical procedures. Hand washing is mainly used in medical asepsis. Procedures included in surgical asepsis: hand washing, gowning, gloving and face masks. Hand washing. Hands should be washed thoroughly for 3 to 5 minutes. Water should move from less contaminated area to the greatest contaminated area. In surgical procedure, elbows are more contaminated than hands. Wipe hands with a sterile towel. Second one is gowning. Doing a sterile gown. Purpose of donning a sterile gown is to apply entire necessary to safely carry out sterile procedures, usually in the operating and delivery room. Donning a sterile gown. First step: grasp folded sterile gown at the neckline and step away from the sterile field. Allow gown to gently unfold, being careful that does not touch the floor. The inside of the gown is towards the user. The rationale behind this is Maintains sterility of the gown and position it for toning. Second step, folding the arms at the shoulder level, grasp the sterile gown just below the neckband near the shoulders and slide arms in the sleeves until the fingers are at the end of the cuffs but not through the cuffs. Rationale behind this, the fingers remain in the cuffs to protect the sterility of the gown and prepared for closed gloving. Third step, have someone tie the back of the gown, taking care that only the ties are touched and not the sides of the gown. The rationale behind this is to maintain sterility of the gown. Gowns are considered sterile in front of the shoulders, sterile from 2 inches above the elbow to the wrist. These are all pictures how we have to wear a gown before surgical procedure. Applying and removing sterile gloves. Toning a glove. Purpose: to prevent the transfer of microorganisms from hands to sterile objects or open wounds. Procedure of applying gloves. Number 1. With fingers still within the cuff of the gown, open the inner sterile glove back and pick up the first glove by the cuff using the non-dominant hand. The rationale behind this is to maintain the sterility of the gloves. Second, position the glove over the cuff of the gown so that the fingers are in alignment and stretch the entire glove over the cuff of the gown, being careful not to touch its edge. Finger remain within the cuff of the gown. Third step, use the sterile gloved hand to pick up the second glove, placing it over the cuff of the gown of the other hand and repeat the glove application process. Last step, fourth, adjust gloves for comfort and fit, taking care to keep gloved hands above the waist level at all times. Rationale behind it, if gloved hands fall below the waist level, they are no longer sterile. Removing gloves. Number 1, wash gloved hands first. Number 2, with dominant hand grasp outer surface of the non-dominant glove just below thumb. Peel off the glove inside out without touching exposed wrist. Rationale behind this, after use, outer surface of the glove is contaminated and could transfer microorganisms to the nurse's wrist. Place ungloved hand under the thumb side of the second cuff and peel off the fingers holding first glove. Inside second glove, discard into appropriate bin. Rational, folding contaminated glove surface towards the inside minimize the chance to transfer of microorganisms. Use gloves to glove, skin to skin technique when removing gloves. Fourth step is wash hands before and after removing gloves to prevent contamination of hands. Next is putting face masks. First of all, wash hands. Remove the clean mask from the container with sterile forceps. Then third, hold the mask by its strings. Fit it to the face and tie the strings at the back of the head. Do not touch the mask that covers the face. It is important that both mouth and nose must be covered. Removing face mask. To remove the mask, wash the hands, remove the gown if worn, Remove the masks and discard it in the container for used masks. Then wash hands thoroughly. Our next topic is disinfection of operation theatre. Operation cleaning of operation theatre is carried out at 3 steps. Number 1, at the beginning of the day it is necessary. Number 2, at between the procedure it is necessary to clean the OT. And at the end of the day, at the end of the day it is very necessary to clean the OT. Proper training of paramedical staff should be done. Fumigation procedure. Main method of sterilization of OT room is fumigation procedure, and it is carried out in 4 main steps. Number 1 is preparation, number 2 is precautions, number 3 is fumigation, and number 4 is neutralization. Preparation. Thorough clean windows, doors, floor, walls, surgery table and all washable equipments with detergent and water. Number 2, clean close windows and ventilators tightly. If there are any openings, seal it with cellophane tape or other material to avoid the leakage of fume. Number 3, switch off all lights, AC and other electrical and electronic items. Precautions to be carried out. Adequate care must be taken by wearing cap, mask, foot cover, spectacles, etc. Formaldehyde is irritant to eyes, nose, and it has also been recognized as a potential carcinogen. Number 3, personal protective equipment should be worn before fumigation. Paste a warning notice on the front door indicating fumigation is in process. Fumigation process. 2 main methods of fumigation process are there. Number 1 is electrical boiler fumigation method. Number 2, potassium permanganate method. First is electrical boiler fumigation method. In this, for 1000 cubic feet area, 500 ml of formaldehyde is added in 1000 ml of distilled water, and this process is carried out for 45 minutes. Second method is potassium permanganate method. For 1000 cubic feet area, add 500 ml of formaldehyde in 1000 ml of distilled water plus 450 grams of potassium permanganate. Add these all in a steel bucket and seal the OT for 12 to 24 hours. Last step is neutralization. Number 1, before neutralization, formaldehyde fumigation system should be taken out from the surgical theatre. Then the toxicity of the formaldehyde vapor should be neutralized with the ammonia solution. Switch on the AC at least 2 hours before the sterility test. Place a cotton ball and pour 300 ml of 10% ammonia on the floor of surgical theatre at least 4 hours before the sterility test. Formaldehyde gas reacts with ammonia gas and produce hexamine, which is considered as a harmless substance. Guidelines to be adhered for the surgical theatre. Sterility. A record should be kept and properly maintained for all fumigations with the following details: date and time of fumigation, date and time of neutralization, personnel involved, and the dates of sterility test. A room allotted for surgery should not be used for any other purpose. Entire block should be thoroughly cleaned before fumigation. All apparatus such as suction table, focus light, Lights, AC units, etc. should be cleaned according to the manufacturer instructions. Surroundings should be clean and free from garbage, open drainage, brushes, shrubs, wastes. Warning notice should be pasted on the front door indicating fumigation is in progress. Entry of the restrictor should be restricted to authorized persons. Separate footwear should be kept at the entrance of the surgical theater. Theater dress includes head caps, masks, apron, and footwear, etc. should be made available for all persons who are entering into the surgical theater. Surgical theater should be cleaned and fumigated periodically depending upon the caseload. Duties of GDA in operation theater. The GDA is responsible for all the instruments and equipments required for the surgery. He or she is responsible for the sterilization of all the instruments and equipments required for the surgery. He or she should scrub well from elbow to fingertips, taking care to clean under the nails and between fingers. He or she should wear a mask and cover his or her head with a cap such that all his or her hair is properly covered. He or she should wear a sterile gown as described under gown techniques. He or she should wear gloves as described under glove techniques, and he or she should handle only the sterile instruments and keep and equipments required for the operation theater. If he or she is incidentally touches unsterile equipments or instruments, she should change her gown and gloves. He or she should arrange the trolley by placing the following on the carbolized trolley: sterile plastic sheets, sterile traps, one on top of the other, instruments in proper order. He or she should count the number of the instruments, swabs, and mops to be taken to the at the time of the surgery so that she can count them again at the end of the surgery. Drum of instruments and equipments not required kept open unnecessarily. He or she should not handle used mops and swabs. Third topic, that is surgical dressing, to be continued in the next video. Thanks a lot.